Hello there. If you've recently been told you have a hiatal hernia, or maybe you're just curious about what it is, you've come to the right place. We're going to break this down together nice and simple so you can feel like you're in the driver's seat.
All right. Before we jump in, we have to get this out of the way. Please remember, this explainer is just for learning. It is absolutely not a substitute for professional medical advice. You should always talk to your own doctor about any questions you have about your health.
So here's what we're going to cover. First, we'll look at what a hiatal hernia actually is. Then we'll get into why it might happen and what it can feel like. We'll also touch on some really important, though rare, warning signs, how doctors find it, and then the most important part, what's next for you.
Okay, let's get right into it. First things first, what in the world is a hiatal hernia? Let's get to know our bodies a little better. So, I want you to picture a big, strong muscle that sits right under your lungs. That's your diaphragm. Think of it like a wall or a floor that separates everything in your chest, like your heart and lungs, from everything down in your belly, like your stomach.
Now your food pipe has to pass through that wall to get food to your stomach, right? The little opening it goes through is called the hiatus. The best way to think about it is like a buttonhole in a shirt. A hiatal hernia is simply when the very top part of your stomach squeezes or pokes up through that little buttonhole and into your chest area.
Now you might be thinking, this sounds pretty unusual. But get this, it's incredibly common. We're talking somewhere between 1 and 5 out of every 10 people has one. And here's the real kicker. A huge number of them have no idea. That right there tells you a lot.
So these hernias basically come in two main flavors. The first is called a sliding hernia. This one is by far the most common. We're talking over 90% of the time. And it's just what it sounds like. The top of the stomach just slides up and down through that opening. Then there's the paraesophageal hernia, which is much less common. This is when a part of the stomach bulges up next to the food pipe.
So that leads to the obvious next question. Why does this even happen? Let's take a look at some of the reasons it can develop.
Well, it's usually not just one thing. A few factors can make it more likely. As we get older, especially over 50, our muscles can just naturally weaken a bit. Carrying extra weight around the middle can also create pressure that pushes the stomach upward. Things that cause a lot of straining, like heavy lifting or even smoking, can also play a role over time. And yep, sometimes it just runs in the family.
Now for the part you're probably most interested in. What are the signs? What might you actually feel if you have one?
This is the #1 question people ask. What does a hiatal hernia feel like? Well, honestly, the answer is probably going to surprise you.
For many people, the answer is nothing. You feel absolutely nothing at all. This is especially true for the small ones. If a hernia is less than 2 centimeters, doctors generally consider it clinically insignificant, meaning it's unlikely to cause any trouble.
Now, when people do have symptoms, they're usually tied to acid reflux. That's because the hernia can let stomach acid splash back up into the food pipe. This can cause that classic burning feeling in your chest we call heartburn, maybe a sour taste in your mouth, or even a nagging cough that seems to act up when you lie down at night.
With bigger hernias, you might feel symptoms that are more about a physical blockage. This could feel like you get full really fast when you eat, or you feel bloated. Sometimes it can make it feel a little tough to swallow solid foods, or cause some discomfort in your chest or belly right after a meal.
Okay, let's switch gears for a second to talk about something that's really important. These next signs are rare, but it's critical that you know when to get help and get it fast.
I want to be really clear here. The symptoms we're about to go over are not common. But if they do happen, they are a medical emergency and you need to get care right away.
So, if you ever experience sudden, severe pain in your chest or stomach, or if you can't stop vomiting and you can't pass gas or have a bowel movement, if you suddenly find it incredibly difficult to swallow, or if you are vomiting blood or see that your stools are black and look like tar, those are all signs to get help immediately. It could mean the hernia is trapped or twisted, and that's an emergency.
Okay, let's get back to the usual journey. How do doctors actually confirm that you have a hiatus hernia? Let's clear up any mystery around the diagnosis process.
You know, a lot of times, hernias are found by accident while a doctor is looking for something else. If they do suspect one, there are a few common ways to check. A barium swallow is where you drink a chalky liquid that helps your stomach show up clearly on an X-ray. An upper endoscopy uses a tiny camera on a thin, flexible tube to look inside directly. Or a CT scan can be used to create a really detailed 3D picture of the whole area.
So, you've got the diagnosis. What's next? This last part is all about your management plan and the steps you can take from here on out.
Remember this, the most powerful tool you have right now is knowledge. Just understanding what's going on with your body is always the first and most important step to managing it well and feeling better.
And here's the main takeaway. A lot of people with a hiatal hernia don't need any treatment at all. For those who do have symptoms, the good news is that they can often be managed with some lifestyle changes and maybe medication. Your doctor will work with you to create a plan that's tailored for you, and it might just include simple things like eating smaller meals or not lying down for a couple of hours after you eat. These little tweaks can make a huge difference.
So as we finish up, I want to leave you with this thought to get you ready for your next appointment. Based on everything you just learned, what questions are you going to ask your doctor? Being prepared with a question or two makes you an active partner in your own healthcare journey.